Well, good morning. Can you all hear me okay? I'd like to take this opportunity to welcome everyone on behalf of the University of Alabama and the city of Tuscaloosa, and we appreciate your attendance today. Before I begin, I would like to take a moment to recognize a number of important university as well as city officials who have students to return. We have deployed every resource at our disposal to provide comprehensive testing, contact tracing protocols, education and training programs, and we've redesigned and equipped our infrastructure to ensure that our classrooms, our dining facilities, our residence halls, and other places on campus are as safe as they can be for our students, for our faculty, and for our staff. I want to express my appreciation to Chancellor Beth St. John and the UA System Health and Safety Task Force for their tremendous support and leadership throughout this process. I'm also grateful to our faculty, our staff, our student leadership, our situational response team, the COVID support team, and many others who have been working tirelessly over the past few weeks to support our campus and to support our students. And finally, I want to say thank you to our students, to our parents, to their families who have entrusted us to provide a safe environment for them to continue to learn and to grow. By returning to the capstone this fall, they have demonstrated the incredible value that they place on the Alabama experience, and I want them to know how much we appreciate them, how hard we are working to keep the Alabama experience that they cherish intact. COVID cases that we've seen in recent days is unacceptable, and if unchecked, threatens our ability to complete the semester on campus. Now is the time for action. And in addition to the stringent measures already taken on campus, we have asked for additional support from Mayor Maddox, the Tuscaloosa Police Department, local business community, and many others. We are grateful to the mayor and his team for their partnership and willingness to explore all options that will help us navigate this pandemic and complete a successful fall. Before we hear from Mayor Maddox, I'd like to ask Dr. Ricky Friend to share a few words. Dr. Friend is Dean of the College of Community Health Sciences, is a member of our situational response team.
I can hear me fine, I'm sure it sounds like. Welcome everybody, and thank you for joining us today. I'm Dr. Ricky Friend, Dean of the College of Community Health Sciences, and as many of you may know, CCHS has led the campus-wide testing efforts since early in the pandemic. Our ability to keep campus safe and informed has hinged upon having accurate, reliable, and rapid testing. We were asked in the middle of last week by Dr. Michael Sagg, chair of the UA System Health and Safety Team, who's an infectious disease expert at UAB, to assist GuideSafe, the group that's doing this student reentry testing, with testing to get that process completed. During that time, we encountered many students who have been exposed since returning to campus, particularly in the Greek system. The trend continued throughout the week and now has reached levels that require a significant intervention. We know from global data that with these measures, we can successfully stay ahead of these trends and actually reduce them to safe levels. Teams both at CCHS and UAB have made recommendations to the Chancellor, UA System, President Bell, Mayor Maddox, and city leaders. In addition, late last week, Dr. Cope, Vice President of Student Life, and his team in the Division of Student Life outlined additional measures by the university to temporarily prohibit on and off-campus student events. We have also instituted a very restrictive policy regarding on-campus housing. In addition, our CV-19 team has worked tirelessly through the week and all weekend to test, notify, and trace each and every positive individual. This week, we will be testing up to 1,000 students per day, 4 or 5 days in locations where geographic runs. We understand the value of these businesses and the value they bring to our community. But we also know that eating and drinking in crowded social environments have been identified as a significant source of virus transmission. When the presence of the virus in our community is high, it is imperative that we limit activities that can lead to transmission as much as possible. We believe we have a limited opportunity to try to curb the trajectory of the student positivity that we are seeing and have validated. This will allow UA to continue its current in-person classes and avoid more economic pain and suffering for our community partners in the long term. We are together in this, and we are prepared to fight and devote whatever resources necessary to curb this trend. It is my sincere hope that we are successful, but will not succeed without stringent compliance and cooperation from every member of the community.
Certainly am honored to have members of the Tuscaloosa City Council joining me today. We have our Council President, Cynthia Allman, Councilor Lee Busby, Councilor Sonia McKinstry, and Councilor Odom. Thank you for being here and thank you for your leadership over the past 6 months. I certainly want to thank many of my team members that are here that have literally had no days off in the last 6 months that bind, because we have a shared responsibility to this community. Dr. Bell, we appreciate you. Dr. St. John, Chancellor St. John, we appreciate you, along with your respective teams. In 2020, we have met this healthcare, economic, and financial burden of the pandemic with an indestructible resiliency that provides hope. We have been inspired by the resiliency of dedicated physicians, nurses, medical personnel, and first responders who have been unwavering on the front lines of this pandemic. Yet it must be met. As has been outlined this morning and based on my discussions with the university over the past 48 hours, the ever-increasing number of coronavirus cases on campus will create 2 major disruptions for Tuscaloosa if left unabated. The first is to our healthcare system. From the start, the city has taken decisive action to protect DCH. This has been our North Star. The second disruption is to our local economy. UA has a $2 billion economic impact on our metro, and thousands upon thousands of our fellow citizens depend upon the jobs that UA provides. Challenge, I often rely on a quote by Winston Churchill, who said, "The truth is incontrovertible. Malice may attack it, ignorance may deride it, but in the end, there it is." The truth is that fall in Tuscaloosa is in serious jeopardy. When you marry the number of coronavirus cases with the contact tracing data, plus the wise counsel of the best medical experts in the country, there is your truth. If we fail to act with the courage of our convictions, DCH will be at risk of being stretched beyond its capacity within the next 4 to 6 weeks. If we do nothing, UA will be forced to go to virtual classes, and the economic consequences will be harsh and long-lasting. These truths are hard, which require me to act within my oath. As mayor, my first responsibility is to protect the health, safety, and welfare of this community and every person that's living here, studying here, and working here. However, for me, it's even deeper. I make these decisions not only as a public servant, but as a husband, father, and son. This weekend, and at the request of the university, I've signed an executive order that authorizes the following. First, the closing of bars effective for the next 14 days, starting at 5 p.m. tonight. This will run August 24th through September 8th. Second, the elimination of bar services at restaurants. We can have table service only, but no bar service for 14 days, effective tonight at 5 p.m. In the fight against COVID-19, it's been our bars and restaurants who have taken the disproportionate impact. It is certainly not lost on anyone at the City of Tuscaloosa. Understanding this, in the near future, I will be working with the City Council and looking at how we can make investments to our bars and restaurants to help them in this difficult time. This can include a myriad of different options, and Tuscaloosa County be placed under a prohibition of sales of alcohol, on-premise consumption at bars for 14 days. As I close, we have to ask the question, will these measures combined with UA's efforts ensure success? The truth is, we don't know. However, the failure to do nothing will cost more lives and livelihoods. We must demonstrate resiliency by acknowledging and acting upon these hard truths. When we make these decisions, the reflex is to focus on the what, but today I'd ask you to focus on the why. For the city, our why is embedded in three principles. First is protecting the people of Tuscaloosa and the students on campus here at the University of Alabama, Stillman College, and Shelton State. Second, it's about protecting DCH regional healthcare system. And third, it's about protecting our local economy and the thousands of jobs that right now are at risk. You know, in Romans 5,